It's Friday, and as we do every Friday in this half hour, Dr. Kevin Kavanagh of Health Watch USA joins us. Dr. K, good morning.
Good morning, Scott.
Let's start with the state news, where an audit has found 600 more deaths from COVID-19 than we had previously counted. Can you speak to the process there and how we came up with those 600 extra deaths?
Well, I really don't know the process because I'm not on the inside, but I'm actually not very surprised that those deaths came out. I've been tracking our health department data for Lake Cumberland region versus the state data for our county. And our county health departments had been reporting almost twice the amount of deaths as what was being reported in the state. Also, if you look at death data, some of the calls that we would sit in, there was a definite lag between the time of death and the time it was reported. And this, I think, Scott, goes to the fact that all of these deaths are investigated. They're just not checkboxed by the provider and then said, oh, it's a COVID death and it's counted. No, they're investigated. And when you have a large peak of deaths, it takes time for those deaths to be investigated. And this is also true in other states. And the death data that we see lags behind hospitalizations and actual infections. Part of this is because it takes a while for a patient to develop enough disease and disability and effects of the virus to die, but also because once the person dies, there's a long process of certifying that death. Now, if you compare that with the flu is just, those deaths are projections and checkboxes, etc. So there will be a lot more flu patients who have died that maybe didn't die of the flu as compared to COVID-19. And if anything, and I've been saying this all along, the deaths that are reported are probably on the safe side. In other words, they're underestimates. And that's why looking at excess deaths may be a better way of monitoring the true fatality rate of this pandemic. But whatever it is very large.
In light of the kinds of investigations that you're talking about here, how do you answer? Because all during this, we have heard from people saying, well, part of the reason the numbers are so high is because anybody who gets it and dies of anything, it's counted as a COVID death. What has to happen for them to specifically say this was a COVID death as opposed to something else?
Well, again, the protocols are going to vary between states, but it's going to depend upon not just the scientists, but also the doctors to certify that this patient died or this death was premature because of COVID. COVID's a tough virus because it affects every organ of the body. For example, you keep hearing, well, he died of a heart attack, not of COVID. Not true. COVID causes your blood to coagulate. Dying of a heart attack is, in fact, a common way of actual dying of COVID because it infects the heart, maybe as much as the lungs. You could even argue it affects the heart and vasculature more. And again, that's why you get into the excess death type of projections. And those pretty much are showing that we're underestimating deaths. And in most pandemics, governments tend to underestimate the deaths because the toll and the numbers tend to be too great politically for them to justify. Not that they have anything to do with it. The virus is independent. It's apolitical. But, they're expected to magically make the virus go away, and that just won't happen.
You mentioned that, and I don't know if this is anything you would even want to touch or not, but one thing that I've noticed with Governor Beshear is that he often refers to it as an evil virus. And my first thought is, it's not an evil virus, it's amoral. The virus may bring on effects that we do not like, that we may consider evil, but the virus itself is amoral. It has no morality.
Well, it's definitely personification of the virus, but it's not even alive. It's just a reproduction of nucleic acids that are surrounded by some protein. I mean, there's nothing there. It can't even reproduce without a host cell, which is its big weakness. And it's why we can break that transmission with masks and social distancing. And that is so important to do because these new variants and the news that we're getting from them, for me, is very concerning. And so we need to follow public health advice, even if you're vaccinated. As we've seen in the Kentucky nursing home, even vaccinations isn't 100% protection. It will help you. It certainly will prevent hospitalizations and deaths. But I get so frustrated when all I hear about deaths because if our existence is being measured on whether or not we die, that's a pretty low bar for survival. I mean, this virus can cause a lot of disability, and we need to try to avoid it. And by all means, get vaccinated. These vaccines are effective, even with the variants. Now, the variants, you still may get sick, but it looks like it really does give you good protection, not 100% protection, but good protection with death and hospitalizations.
I intended to say this when we spoke the other day. I'm not sure if I did or not. I had always understood that the vaccine may not keep you from getting the virus, but if you do get it, the vaccine is going to significantly decrease your odds of having severe symptoms or dying.
Well, and I think that's true. And if you look at what happened in the nursing home in Kentucky and you look at the reported data, there was one hospitalization in a high-risk elderly patient out of 71 vaccinated residents, compared to 4 hospitalizations out of 13 unvaccinated residents. Now, that's with a variant. That's not with our strain of the virus that we had all last year. That's with what they think is a variant. So that provides very good protection. But it doesn't mean that if you get sick, you can't develop long hauler syndrome and all these other sequelae that we've heard of. And we're still learning more about those types of problems. But I'll tell you, Scott, those are problems I'd like to avoid. I'd like to be able to go to Starbucks and other restaurants and not have to worry about any of this. So again, wear a mask, even if you're vaccinated, because a vaccine with these variants may well prevent you from getting severely sick. But if we all agree you can get infected, that also means you can spread the virus. And we don't want that to happen because far too few people have been vaccinated to date.
All right. We've seen some headlines that the CDC is considering reducing that social distance from 6 feet to 3 feet. Is that in general, or would that just be for schools?
Well, right now they're saying for schools, but that's the question I would ask. Well, we're going to do that everywhere. Again, I think it's very ill-advised. I'm not at all surprised that 6 feet works as well as 3 feet in schools. It's an indoor setting. This virus aerosolizes, and it's going to zap you whether you're 3 feet or 6 feet. You need to upgrade school ventilation and air sanitization. And that should be done anyways, regardless of the pandemic. We need to upgrade our schools. Again, people are saying, well, we can't cram that many kids in a classroom. I'd have to ask, do you really want to cram that many kids in the classroom? These class sizes, when they talk about reduced class sizes, they're the sizes we were complaining about back when I was in grade school. I remember my parents complaining that they were increasing the class sizes to 20 or 25. Now that's considered a small class size. So we really do need to put more resources into education, regardless of the pandemic. The children are our future. So I think it's ill-advised. I think we ought to be addressing public education rather than redoing our recommendations to fit what we have.
We got a text here from Bill who says he recently heard that the vaccine may only be good for, say, 3 months. Well, we need to be getting boosters every quarter or so.
Well, the second part is probably not. The first part is they really don't know. And this is one of the big problems with scientific data and how it translates to the public. And this is true with long hauler syndrome. If you follow a person or you do a study at 3 months or 6 months, then you report the data. The vaccine gives you coverage for 6 months. When people read that study, they say, oh, it only lasts for 6 months. No, they just studied it for 6 months. And so we really don't know how long it lasts. I would suspect it's going to last at least a year because these vaccines give you better immunity than the infection. And I'd like to touch on that point if I could. If you remember the spat yesterday between Dr. Paul and Dr. Fauci, one of the important things which was said by Dr. Fauci, and I'm going to quote him, in the South African study conducted by J&J, they found that people were infected with wild type were exposed to the variant in South Africa. It was as if they never had been infected before. They had no protection. So prior infection may not give you any protection with these variants. And the disturbing thing of this is you can say, well, we don't have a lot of South African variant in the United States. We have some, but not a lot. Yes, but the New York variant has very similar mutations, and that's becoming the dominant variant in New York State. So this is concerning. But if you look at the vaccines, the Johnson & Johnson vaccine, after 1 month of being vaccinated, it prevented hospitalizations when tested in South Africa. All of the hospitalizations. And at that time, 95% of the individuals in that study had the South African variant. So the vaccines give you better protection for the variants. So again, get vaccinated. We have in our toolbox what we can use to stay safe. And that is very important. Do not assume that just because you've had the infection and you had the infection with last year's virus, that you're going to get protection with these new variants. The data is that probably won't happen.
And Rick, good morning. You're on with Dr. Kavanagh.
Good morning, y'all. Dr. Kavanagh, people wearing masks when you're driving and you're the only person in the car. Is that an alternative to spreading COVID?
Well, I've done that, and I think that's just because if you go from one place to another, you're not going to want to touch a contaminated mask and take it off. So I wouldn't assume that they're, scared about wearing a mask in the car. Of course, I've also seen people wear masks while on Zoom, and I've questioned them on that and pointed out you cannot spread the virus over Zoom. But again, you've got to remember that that's just one point in time. If they're driving from point A to point B, they have on a mask, they think that mask may be contaminated, they're not going to maybe want to take that mask off until they get to the next location. Yeah.
Thanks for the call, Rick. We appreciate it. Dr. Kavanagh, we have heard here in this country, we've got the vaccines from Moderna, from Pfizer, from Johnson & Johnson, but we've been hearing a lot, especially this past week, about controversies related to the AstraZeneca form of the vaccine in other countries. What, if anything, can you tell us about what's going on there?
Well, that has to do with side effects and whether or not it causes hypercoagulability of the blood, in other words, blood clots. Remember, we've discussed that can be a problem with COVID-19 also. And because of that, there's a big debate on whether or not these rare occurrences are caused by the vaccine or not. There's also some concern, especially in South Africa, if it works against the South African variant. But one of the things I thought was interesting is that we're shipping 8 million doses of this vaccine to Canada and Mexico. The United States is. Of course, it's not approved in the United States. So I think it's an effective vaccine, but I think compared to Moderna, Pfizer, and Johnson & Johnson, it may not be quite as desirable to have. There's more controversy around it, and it would certainly fuel our anti-vaxxer movements. And so I think it's a good move to stick with what we've got. We've ordered enough doses to cover the population and probably not have AstraZeneca as one of the modalities in this country.
David, good morning. You're on with Dr. K.
Hi, good morning. Doctor, I just want you to clarify a statement you just made about someone fearing that they may get contaminated by taking their mask off, blah, blah, blah. I mean, on the face of it, that's just an absurdity that somehow wearing your mask out in public, these masks that aren't even capable of enough to stop, via the micron level of these viruses, they really do nothing. It's sort of, maybe it keeps your face diaper from you sneezing just completely outwardly. But for you to say that now somehow that you won't be contaminated by your mask, but then you take it off and touch your mask, you'll be contaminated? That just sounds wackadoodle, sir.
That's not correct because the virus is on the outside of the mask.
Well, what keeps it from traveling inside the mask?
If you want to.
Because the mask has some filtration. The size of the virus or the particles that can aerosolize are not just droplets, but up to 100 microns. That's out of the National Academy of Sciences. And cloth masks can stop some of those. And so can KN95s and N95 masks, which you can buy on Amazon and over the internet.
So no,
it might limit exposure. It might limit exposure, sir.
And limited exposure is important because disease severity is related to the dosage of the virus that you get.
So a small dose doesn't incubate into a larger. So you were saying that just a very small dose will give you a smaller reaction than a larger dose? It doesn't incubate within your system?
Good evidence on that.
Because it's a race between the virus and your body's immunity. And the more soldiers they land on that beachhead, the more head start that virus has.
So yeah,
I see the alphabet.
Severity is dose related. And masks help. They've helped in every pandemic that we've ever had. It's not just this pandemic. They're used in almost every country. They're not used necessarily in Australia, New Zealand, because there they followed good public health advice and snuffed out the virus. If we would have done as well as those countries, we would have had less than 15,000 deaths total in this nation.
So they've beaten the common cold. That's what you're going to tell us. They've beaten the common cold. That's just ridiculous.
They beat COVID. It's not ridiculous. So did South Korea. So did Taiwan. They followed good public health advice and strategies. Masks work. If we don't adopt them, we will have this virus endemic.
And 2 masks are better. So you're also going to find that 2 masks are better. Is that correct?
David, we're out of time.
Yeah,
I got to let you go. Thanks for your call. We appreciate it.
The second mask is to make the first mask fit better so it doesn't have gaps on the side and aerosolize the virus. If you have a KN95 or an N95, which is well fitted, you do not need 2 masks. So the second mask isn't to increase filtration. It is to cause that first mask to fit well against your face. That is the idea of the second mask. Again, misinformation. We need to pay attention to the science because in all likelihood, we are headed now for another surge. So if we pay attention to the science, we will do well. If not, we will suffer the consequences.
Dr. Kevin Kavanagh, thank you so much. I know you'll be back with Jack on Monday morning. Have a good weekend.
Thank you, Scott.